Kentucky as a state, we're #1 of all states in cancer mortality. We're #2 in cancer incidence. Nowhere in the country is that worse than in Appalachia and Eastern Kentucky. There are a lot of cancer prevention and control programs that Markey Cancer Center investigators are doing in Appalachia. 10 years ago, the state of Kentucky was ranked 49th in the country for screening for colorectal cancer. Our investigators have worked with statewide investigators, and now Kentucky is ranked 23rd. We'd love to be in the top 10, but no other state has undergone that rapid of an increase. 10% of our patients who come here are enrolled in clinical trials, so that makes a huge difference because we're trying to really understand which treatment options are best for certain cancers, and we see about 50% of our patients who are enrolled in clinical trials are from Appalachia, which is really important. Many of the discoveries made at the Markey are already in clinical trials, not only just here, but across the country. We have a drug that will be starting clinical trials in Europe coming up this year. We have a group of investigators looking at something called triple-negative breast cancer, and they're very aggressive tumors. So we have a group of investigators who are doing some wonderful work. They have some potential compounds that are coming down the pike as well. We also have great fortune to have one of the top pharmacy schools in the country located at the University of Kentucky, and so we're doing a lot with investigators in the College of Pharmacy for new drug development. We treat the entire patient, so we can offer teams of not only investigators but clinicians who are very focused on specific cancer types. And that's very good for treating the entire patient who may require surgery, who may require chemotherapy and radiation therapy. But we also want to make sure that patients are offered these same types of treatments in their own setting, in their own hometowns. We have now 8 affiliate hospitals that we work with very closely in order to make sure that if they require radiation treatment or chemotherapy, that's something that we can work with their physicians at the local hospitals. What separates the Markey Cancer Center from other cancer treatment centers is that we have a very active research unit. Taking basic science, cancer prevention control, and drug therapy, we have great examples in all of those areas.